Do you like my shirt? You like my beautiful butterfly? Thank you. Would you like to know what it represents? It represents neurofibromatosis. If you cannot say neurofibromatosis, that's totally fine. It is a very long word. You have to practice it often. But this is a disability that I have. It is a genetic mutation that I was born with. I was diagnosed when I was 3 months old. And why am I talking about this? Because May is NF Awareness Month. Duh. The abbreviation for neurofibromatosis is NF, but there are 3 types. There's NF1, NF2, and schwannomatosis, which is another really long, hard word to say. Neurofibromatosis is a rare genetic mutation that causes plexiform neurofibromas, which is a type of benign tumor, to grow on your nerve endings. This right here, that's a tumor. I'll get up closer, 1 second. Some side effects from this disability causes this right here, that is a plexiform neurofibroma. It is a tumor. If I have it removed, then it will cause paralysis in my arm. It does cause partial paralysis in my arm and hand. But another side effect is also these spots right here. Let's see, the lighting isn't that great. Okay, there we go. These spots right here, those are called caveolae. And then I have some more over here, and I have them all over my body. Those brown spots are the easiest part of this disability. It's just an indicator for any like neurologist or just like a general practitioner doctor to see like if someone has NF. Sometimes you can have those spots and not actually have the actual disease, you just have some of the symptoms. For me, the area in my body that's affected most of all is my neck. Like I showed, ow, I just stabbed it, and my entire spine and pelvic area. Some of the tumors wrap around all of my muscles in my back and my ribs, and it's not fun, but you know what? I've had this my whole life, so I'm kind of used to it. I do have chronic pain. There's not really anything I can do about it, except I use a heating pad if my back really hurts, and I just, again, started physical therapy recently, and I'm gonna start occupational therapy as well in the next few months to help me with my dexterity in my hands, mostly in my left hand. To keep my disability in check, I do see all sorts of different kinds of doctors, and I have all sorts of different kinds of scans like MRIs, PET scans, ultrasounds, just to make sure everything's like healthy and that I'm strong and that everything's okay. But I'll talk more about that in another video. This might not be super informative, but this is just the beginning of like the easier parts to talk about. Okay, so happy NF Awareness Month, and I'm looking forward to educating you more on my disability.